Good morning. I'm here today to announce more support for Alberta businesses that have been hurt by COVID-19 public health restrictions. We've been fighting this pandemic battle for over a year now. It's a battle to protect both lives and livelihoods, and one that Albertans have taken head on. By now, we all know somebody who's been affected by this disease. If not by its potentially fatal health outcomes, then certainly by its broader impact on jobs and the economy, on people's ability to put food on the table. Those of us around the cabinet table who've had to make incredibly tough decisions know that every time that action is taken to limit viral spread with public health measures that we've had, like we had to do a week ago, that we put stress on already overburdened entrepreneurs and job creators. That's why Alberta's government is helping them get through this. Throughout the pandemic, Alberta's provided the highest levels of support for small businesses in the country, nearly $1 billion worth. At $985 million, Alberta has provided by far the highest per capita cash grants to job creators, more, for example, than BC, Quebec, and Saskatchewan combined. Alberta's government has also provided historic support for job creators through more than $4.1 billion in additional support, like, for example, $1.5 billion in business tax deferrals, $1.1 billion for WCB premiums and deferrals, and we've assumed half the cost of those workers' compensation premiums for small businesses. $1 billion for the federally funded site rehabilitation program, $575 million in Relaunch grants for small businesses, as mentioned, $100 million to childcare operators safely to reopen facilities, $30 million in agricultural support and forestry protection, $67 million in rent relief, and much more. Today, we are building on that support. Next week, we are reopening the a small and medium-sized enterprise relaunch grant for a potential third payment of up to $10,000 for those businesses that are affected by public health measures. The previous rounds of funding saw nearly 100,000 applications submitted from businesses that employ about 300,000 Albertans, with over $650 million in support approved. With this expansion, we're allocating another $350 million, bringing the total support for the small business, small and medium-sized enterprise relaunch grant to, as I say, just about $1 billion. And it means that no other province or territory has provided nearly as much COVID relief and support for small businesses who are the unsung heroes of our economy. This expanded program also makes hotels, taxis, and ride shares eligible for support. So we heard from those operators. If a business received the previous payments, they can now receive as much as $30,000 altogether in support from this one program. We're further expanding the time frame in which businesses are eligible to include those that began operations between the 1st of March of last year and January 31st of 2021. The revenue requirements for the program remain the same. Businesses that have experienced a 30% reduction in revenue will qualify for funding. The updated SMERG program will replace the previously announced Enhanced COVID-19 Business Benefit. That program was intended to support the business as we lifted restrictions, but with new measures necessary to curb the surge of viral variants, we're extending the previous program to provide necessary support to a wider range of businesses, and just to do it more quickly. The program will be able to accept applications within the coming days. Just stay tuned for an announcement about when it goes online for application. There is still much more work to be done. Thousands of Albertans are facing difficulty and uncertainty, but we know that brighter days are coming. We're seeing national banks and think tanks projecting that Alberta will lead Canada in economic growth and job creation. And the most recent job stats out of StatsCan last week showed 37,000 jobs were created in the month of March. We've ramped up our vaccination campaign to deliver up to 40,000 doses a day, and will soon be able to deliver as many as 70,000 a day. With natural immunity from those who have already been infected and the protective shield of vaccines, we will hopefully be able to see a return to normal by summer. I remain hopeful that we'll have a Calgary Stampede, that we'll once again be able to raise a pint with friends and toast our nation on Canada Day, and that we'll be watching our kids' soccer and baseball games on those beautiful Alberta summer days. We are so close. We just need to hold on just a little longer. So thank you, and with that I'll turn it over to the Minister for Jobs, Economy and Innovation, Doug Schweitzer.
Thank you, Premier, and thank you to those that are participating here today. As the Premier noted, over the last few weeks, we've brought in new health measures that have impacted small and medium-sized businesses and enterprises across Alberta. And we have to be there to support them, to help them get through to the other side of this pandemic. And we know many of the small businesses are frustrated. They want to get back to normal. They want to get back to operating and providing services to their customers. And we as a government and as a community and society are asking them to make significant sacrifices to help us keep each other healthy and to make sure that we can get through this pandemic, preserving as many lives as possible and also preserving livelihoods of Albertans as well. So with this Relaunch grant extension, we're opening up, as the Premier had noted, for an additional $10,000, up to an additional $10,000 to small businesses that have seen their revenues drop by 30%. And again, we know that this isn't necessarily going to keep all those small businesses whole, but when you add on the federal supports for rent subsidies, as well as wage subsidies that the federal government has put in place, with the measures that we've put in place as our government as well, in many different areas, this is intended to help small businesses get through to the other side. And we would just encourage all Albertans that want their neighbors that run small businesses to reopen and be successful long term. They know that how important they are as pillars of our community, sponsoring community sports, sponsoring leagues, sponsoring our arts, all the different things that small businesses do in our communities. It's incumbent on all of us to get vaccinated when it's available. We need to make sure we have Albertans, stepping up and making sure that they get vaccinated at the earliest opportunity when they're eligible. Again, we are ramping up our vaccination efforts here in Alberta, but if you want those small businesses open as fast as humanly possible, all of us need to do our part when those vaccines are available to us so we can get to that herd immunity, so we can start reopening society and getting back to that normal summer at the earliest possible opportunity. As far as the timing goes for this announcement, as far as when it's going to be available to small businesses, we anticipate that the application portal online is going to be available next week. We're just working on the specific dates. We're moving as fast as possible. We do believe that it'll be available next week for applications to come in. And the turnaround time. With our initial round of the Relaunch grant, the average turnaround time from application to funds going out the door was about 10 days. So once we get this application portal open next week, we anticipate that funds will be flowing close to the end of this month for small businesses that need that support. So again, just really want to reiterate our thanks to all of the small businesses out there across Alberta that we're asking to make sacrifices. And we know it's not easy, but we also just want to say with an immense amount of gratitude in our hearts, thank you for what you have done for all of us to keep us healthy. And we're going to continue to be there to support small businesses to get through to the other side of this pandemic.
Good morning, everyone. We have time for 2 questions off the top or 1 question and 1 follow-up today. Please indicate who you are directing your question to. And with that, operator, can you please put through our first caller?
Jesse Weisner, Global TV. Hi, this question is for the Premier. I'm wondering about the province's stance on the state of hospitals and capacity. Some feel their healthcare needs are being dismissed due to the focus of COVID-19 in our Calgary hospitals. Can you offer a perspective on the impact of COVID when it comes to other medical concerns and prioritizing non-COVID cases?
Well, as you know, in Alberta, we have about 8,300 acute care beds, of which we have about 300 occupied currently by COVID patients. On a typical day, we would have about 250 intensive care beds across the province, about 80 of which are now occupied by COVID patients. So overall, it is, I know it's a real stress on the system, and our thoughts go to the tremendously professional frontline staff who have been under great stress, especially the ICU nurses, respiratory therapists, and docs working in the ICU units. Having said that, in the context of the overall system, we can manage the current pressure. Alberta actually has done better than at least all of the large provinces in keeping on top of surgeries. We did postpone a number of non-urgent surgeries a year ago in the spring first wave of COVID, but worked very hard last summer and early fall to reschedule those. And as you know, Minister Chandra and I announced in the budget hundreds of millions of dollars for additional money to speed up surgeries, reduce wait times, partly to recover from the COVID overhang. So I think we are doing relatively well, all things considered, in managing both the imperative of COVID care, but also non-COVID related health care. Now, not to say that people haven't been affected, but, you know, and the main reason, that one of the central reasons that we have brought in painful and difficult public health restrictions is precisely to protect the capacity of our healthcare system. We don't want to trip into a situation where we have to go back into mass cancellations of surgery. So there has not been significant postponement or cancellation of surgeries or non-urgent care since last fall. That hit Edmonton particularly hard because of the surge of cases at the time. But since then, the data we have is that we've largely caught up. We're following that very closely.
And is there a follow-up?
I actually don't have one. Thank you.
Thank you.
Operator, can you please put through the next caller?
Our next question comes from Rick Bell, the Calgary Sun.
Good morning, Premier. You've said a lot of hopeful things in the last couple of days for people. On the other hand, do you have some sort of backup plan if the numbers don't start plateauing and coming down? In other words, are additional restrictions, whatever they be, going back to what it was like last spring, or closing schools, or whatever would happen to be, stay-at-home orders, whatever, are those on the table or off the table if the situation gets critical enough?
Rick, I've been clear from day one that we'll take the measures necessary to protect lives and the healthcare system. We have tried to take a targeted approach using restrictions as a last and limited resort. That continues to be our approach. If we see that the recent measures don't improve compliance, and if indeed the variants drive growth even more quickly, if, for example, this new, even more virulent P1 Brazilian variant becomes a dominant variant in Alberta, and we see exponential growth just continue, we might have to take additional targeted measures. That's the last thing that I want to do, especially at the very end of this when we're so close to the goal line. You know, I study this data every single day, and all of the different projections, the capacity in the healthcare system, where the variants are headed. And I believe, Rick, I'm confident that Albertans are responding to our plea to limit social interaction, to stop viral transmission. And that means we should be able to catch up with the vaccines over the next month or so. So I don't believe we're going to have to take further steps. But, Rick, I just point out to you and to Albertans what's going on in Ontario. I don't mean this to be critical of the government. You know, one thing that we've learned throughout COVID is that COVID has a mind of its own. And while government has certain policy tools to try to limit spread, there's a lot of other factors at control, you know, population density, weather, and a whole lot of other factors. And what we see in Ontario right now is that they are very close to reaching the peak of their ICU capacity in their hospitals. And they have had to take extraordinary measures to try to slow the continued growth, so they are not put in a position of denying people care at ICU. So my commitment to Albertans is we will not go there. We will not put our doctors in a position of deciding which patients live or die. That to me is a absolute no-go zone, and that's why we keep open the option of additional targeted measures should they be strictly necessary.
My supplementary, I was actually intending to ask you something else, but because of your first answer,
well, you can probably smuggle in 2 more, Rick. We'll be generous.
Okay, well, one of them is the following what you said. What kinds? I know it's a hypothetical. I understand that, but just so people understand, what kinds of things? I mean, obviously, closing schools might be something, I guess. So, asking more specifically about what those things can be, and how do you sell it to Albertans when it's no secret that there are many people, including people who voted for you, as I've mentioned often, who are including people in your caucus, who are resisting the current restrictions, let alone further restrictions. So how do you sell, if you had to sell that idea, how do you sell that to people who are not liking what the restrictions that even are on now? And what kind of restrictions are we talking about? I mean,
okay.
Yeah, and then we'll go from there.
All right. Thanks, Rick. So in response to your question about what kind of additional targeted measures might we take, I would just refer you back to different public health measures that we've had throughout the past year, which are not currently in place. And again, I would just, let's put this in perspective. To those folks who are really ticked off about restrictions, so am I. So is this government. We do not do any of this lightly. We only do it because, again and again, we appeal to people to regulate themselves, to exercise personal responsibility. But, Rick, we have for example, let me give you one example of what happens here. We have in the county of Athabasca, nearly 2,400 cases, 2,400 cases per 100,000 in population. That would be the largest local outbreak in a local area since the pandemic began in Alberta, and I think one of the highest local infection rates in any local community in Canada since the pandemic began. Sadly, much of that was transmitted by kids, much of that coming out of a birthday party. Now, the parents who hosted that birthday party undoubtedly did so because they loved their kids, and they wanted to give their kids a chance to have a normal birthday celebration and to socialize with their friends. Everyone can understand that. Parents who are concerned about their children's mental health. But the reality is, by doing that, there was apparently a 100% infection rate at that party that then went to parents' homes, that then went to coworkers, that's then affected the whole community. This isn't to target the community. It's just simply to give you an example of what happens when people think that they should just be exempt from the guidelines. What happens is it can hit people that you love very hard. It can hit your neighbors hard, your coworkers, your family members. And what else do I say to those folks who are upset about restrictions? Same thing I said to you yesterday. If you know somebody who's waiting for heart surgery or cancer surgery, and you don't want that surgery to be delayed, help us out with this for a few weeks. Unfortunately, I think, amongst some who are opposed to restrictions, there's just this belief that, I don't know, amongst some, not all, that COVID is exaggerated or there's just some easy solution that we haven't found yet. I would just ask them to look around the world. We have some incredibly sophisticated, advanced European countries like Germany, for example, that are in hard lockdowns right now, much harder than Alberta, to cope with the same problems. This is not an Alberta issue. This is a global issue. And then I would just say finally, to those folks who are upset, if they would want us to take the approach taken by some U.S. states, okay, That's a defensible position. But then you have to defend the consequences. And the consequences, I was talking to a friend in Arizona last night who said everything's back to normal in Arizona. I said, that's great. First of all, I said by the end of February, Arizona had about a 32% natural infection rate and about 15% vaccination. So nearly half of their population had protection from COVID at some level. And they're now at like 80% between vaccines and natural infection. But I said, secondly, our Arizona's death rate has been 5 times higher than Alberta's, with a younger population down there. A lot of Albertans know Arizona well. Some Albertans holiday down there and have family down there. If you were to take Alberta's per capita death rate and apply it to Arizona or South Dakota or any number of U.S. states, it would be 10,000 or more deaths rather than 2,000. So I ask those folks who are upset about restrictions, would you, if you were in my position, be willing to defend a COVID death rate 5 times higher than what we have experienced? I don't think any reasonable Albertan would say yes in response to that.
Operator, can you please put through the next caller?
Our next question comes from Lisa Johnson, Edmonton Journal.
Hi, thanks for taking my question. I'm wondering if you spoke a little bit about the urgency and the timing of this announcement, obviously with the latest round of COVID restrictions, but I'm curious to know why the enhanced COVID-19 business benefit program, which was just about to roll out in April, why that was scrapped in favor of this. Is this an acknowledgement of the criticism that we heard from some businesses that the threshold was too high to meet to be eligible for?
Well, good question. That program was designed at a time when we were beginning to relax restrictions, and 99% of businesses were able to operate. But there was still a small percentage who had largely been closed for the better part of a year, like, for example, dance academies, dance studios, and gyms and so forth. And so we felt we needed a program that was targeted on the small subset of businesses that had been hardest hit throughout this, and rather than a general program. But, of course, we've had to increase stringency of public health measures to protect lives in our healthcare system. And so we're back into a different context where there are more businesses affected, such as all of the restaurants and bars, for example. And so we decided that the right thing to do was to go back to a broader application with a lower threshold to qualify. And the other advantage of this program is it moves fast. You know, we are at the end of this thing. Every day counts. We know that the decision we made a week ago meant that restaurants, for example, have spoiled inventory. Some of them are going to have expenses to build out patios so they can serve outdoors. And we want them to be able to do that immediately, and not wait until it's too late, until we're into June and past many of the restrictions. So that essentially is what informed this decision to replace the planned enhanced benefit with this. Doug, do you want to add anything to that?
Premier, you've covered it quite well, and it really was the enhanced COVID-19 business benefit was there for, excuse me, for our reopening strategy. We had an outline, steps 3 and steps 4, and we knew what businesses we were asking to make an immense amount of sacrifices. So we designed that program for the businesses that have been impacted the most. Now that we have these additional health measures in place, it is impacting far more businesses across Alberta. So that's why we've gone back to a far broader application with the Relaunch grant.
Lisa, do you have a follow-up?
Sure, thanks. I'm also wondering, last week the Alberta NDP was calling for enhanced support. Their calls went a little bit farther than this. So is now maybe the time, would it be better to go full bore with these supports, given what you're saying that, that we're almost through to the other side? What would you say to criticism that this is not enough for stay operating through the end of this pandemic?
Well, first of all, I've never seen a program where the NDP thinks we're spending too little. Where the NDP thinks we're spending enough. They want to spend more on every program all the time. and that's why we ended up inheriting an $8 billion deficit. So even in this context where we're making extraordinary investments to help people get through the pandemic, we have to be mindful that there are limits with an $18 billion deficit. Now, having said that, I would say we are going full bore. If you compare Alberta's cash support for small businesses affected by the pandemic, it is far greater than any other province on a relative basis. So with this additional $350 billion program envelope today, we're talking $1 billion in support. That far exceeds the direct support given by other provincial governments across the country. And it's in addition to things like us picking up the tab for half the WCB premiums for businesses. So, in fact, I would see this, and this is coming out of the $500 million contingency for COVID economic measures that was included in the budget. So we kind of foresaw the possibility we might need to do something like this. We put space aside for it in the budget. But this government is doing more than any in Canada by a country mile to support businesses that are affected, especially small businesses.
And we have time for 3 more questions this morning. Operator, can you please put through the next caller?
Bill Fortier, CTV News.
Hi, Premier. I'm just wondering, and I know this has been a moving target with the pandemic, but do you have a goal? With all of this spending, it's going to be, take longer to get back to a balanced budget. Do you have a goal now at this point, or even a rough idea of when that could happen?
Well, we addressed that in the budget. We clearly can't realistically get back to balance in this term of government, as we had hoped to. In fact, we had a credible plan to do that prior to being sideswiped by COVID, the global recession, and the energy price collapse. But with about a 2.8% reduction in overall government spending, we're on a credible track to balance by the year 2023. Now that's going to have to be delayed by at least a couple of years. There are so many unknowns, it would be irresponsible for us to make a hard prediction about getting back to balance. But I truly believe it can happen in the next term of government, so I'll call it in the midterm. Announcements like today's, I don't think really get in the way of that, because we see this as one-time only COVID-related spending. This doesn't get hardwired into the budget as a repeating expense every year. So the $350 million in additional business support announced today, the $1 billion in small business support overall through COVID, those are one-time only COVID costs that we feel we have a moral obligation to do, because the government has imposed those costs on those businesses, and it's the least that we can do, in addition to the other support that they get. The Government of Alberta has participated with the federal government, for example, in the commercial rent assistance program. Of course, they can also access the federal wage subsidy program and other supports. So, but here's my view. At the end of the day, the best way to get our province's finances back in order is economic growth. Economic growth that means more jobs, and with more jobs, higher tax revenues. So growth is the best way to balance the budget, and we need to make sure that these small businesses survive this crisis to help us with that growth. And I'm optimistic. They've just got a few more weeks to get through this, come out on the other side. There's a lot of pent-up savings. I think we're going to see that trade in the service sector is going to take off like a rocket after the pandemic. People are going to want to go out and enjoy themselves and patronize the kinds of businesses that have been affected. And the projections for Alberta are over 6% growth this year for most banks. And so I think we're going to see a really strong second half this year. And this is one way of helping us to get to that side.
Bill, do you have a follow-up?
Just a quick follow-up. When you say this government has done more than any other government across Canada, specifically, what do you mean? Do you mean per capita emergency spending total on COVID-related, or do you mean specifically small business supports? And again, I assume you're meaning per capita.
Yeah, I do mean per capita that we can get you the exact statistics, but my understanding is that no other province has come close to matching what we put into small business grants. We've done, with this announcement, $985 million in the small medium enterprise relaunch grant, which is more, for example, than the provinces of British Columbia, Quebec, and Saskatchewan combined. Doug, do you have more information on that?
Yes, Premier. So, for example, with our initial round of the Relaunch grant, we had almost 100,000 businesses apply, and we're seeing, again, with this program that we're announcing right now, we're expecting 50 to 60,000 businesses that have been impacted by these most recent health measures to also qualify and apply for this round of the Relaunch grant. So we've cast a very wide net to support as many businesses as possible in Alberta that have been impacted directly or significantly impacted by health measures. So it really goes to the efficiency of the program and the speed of reply of about 10 days turnaround time, as well as the uptake in the community as well.
Thank you. Operator, can you please put through our second last caller?
Michael King, Global News.
Hi there. This one's for the Premier. I know you're not in the business of telling owners how to run their companies, but with the last two rounds of funding, what are some examples of where this money was spent, and are there any recommendations, such as using it for PPE, sanitization, barriers?
Sure. Look, a lot of them, and I think in the first round, did use the money for personal protective equipment, for things like dividers and in some cases improving their ventilation systems. I visited a dance studio here for kids in Edmonton where they said that this program kept them alive because it helped them to keep their staff engaged and to pivot to online programs, for example. So a lot of businesses I know use this to improve their online offering. For example, some restaurants have done okay over the past year by developing a strong takeout business, and some of them used this funding to develop really professional websites to help promote their business, their products. So I think it's the flexibility that's been very important here. I'll tell you this, I've met a number of small business owners who've said that this program helped to keep them alive, partly because the federal programs have been super helpful, and we really appreciate them. But this is it's a low-touch program. It's easy to apply and qualify and get the money quickly into their account with maximum flexibility, as opposed to like the commercial rent assistance, which has understandably a lot of strings attached to it. Doug, do you have other input on that?
No, and this goes to that point that you're raising, Premier, is that every small business is a little bit different, even when you look at the restaurant industry. So if you have drive-through access versus a restaurant that provides breakfast services, we're serving omelets, very different business models. So even when you look at individual kind of lines of business, from restaurants to the tourism industry, each small business is a little bit different. Some of them have different loan structures, some of them have different ownership structures. So we really want to make sure we provided flexibility with this program, ease of application, speed in getting the funds out the door to make sure small businesses, who know how to run their own business, can make the best decisions for them to help them get through to the other side of the pandemic.
But I don't want to exaggerate the importance of this program. Well, I think Alberta's been, compared to the rest of the provinces, very generous in this kind of support. At the end of the day, $30,000 doesn't make any small business whole with the hammering that many of them have taken over the past year. And let's be clear, much of that adversity is not related to the public health restrictions, but just the general downturn in the economy. A lot of these businesses had already survived 5 pretty tough years in Alberta's economy. And then, I think that some Albertans imagine that all of the adversity for businesses is associated with public health measures. In fact, at the height of our restrictions in the spring of last year, 85% of Alberta businesses were able to continue to operate. And through most of the past 9 months, it's been about 99% of businesses able to continue to operate within public health guidelines. But the bigger impact has been just the general economic impact of the largest recession in the world since the 30s and the largest collapse of energy prices in history. So those things plus the restrictions have hit them hard, but between the federal and provincial programs, hopefully these businesses can get through just the next few weeks.
Michael, do you have a follow-up?
Yeah, there's also an audit process in place through the first 2 rounds of funding. Has that been used? Has any of the funds been clawed back through that?
Doug?
This program is available for non-for-profits as well. It's so small and medium enterprises, non-for-profits are still going to be eligible for this next round of the Relaunch grant. And as the Premier noted as well, we've expanded it to include the taxi industry and a few other categories as well that we heard feedback from that needed to be included in this round as well. So again, this is a broad application process. It's meant to help those small and medium enterprises, non-for-profits as well, that have been impacted by health measures right now. And to the Premier's point, this is really designed. We're in the final throes of this. We're weeks away, we believe, from the vaccines coming in that are going to allow us to loosen these health measures that have been brought in. So this is designed to help these enterprises and businesses get through to the other side of this pandemic and into the summer months.
Doug, I'm not sure if you have a speaker problem down there, but the question, just to be clear, the question was about auditing, whether we've clawed back funds from anybody who inappropriately received the funding.
Oh, sorry. I thought the question was about non-for-profits. On the audit side of the things, we do have an audit function built into this. The original Relaunch grant program went until the end of March. We do have audit processes that are built in. We work with the Auditor General on that. That process for last fiscal year is just beginning now to make sure that there isn't any instances of fraud. That being said, the online application portal does identify if you have numerous applications coming from one address or similar bank accounts, things along those lines, it flags those ones for further follow-up. There may be justified reasons for that, but there are safety mechanisms built into this to make sure that we reduce the opportunity for fraud.
Thank you. Operator, can you please put through our last caller?
Audrey Nouveau, Radio Canada.
Audrey, are you there?
Yes. Obviously, someone had to be on mute today. Thank you for taking my question. I'll ask it in English and in French, the first one. We've talked to experts who say that your message and the health authorities' message will be crucial in the next couple of days to influence people who could be swayed either way about respecting the health measures that are in place. So what do you say to those people who feel like they're really tired and they want to give up, but they're not sure they're going to do it? They are still debating this.
Well, in English, then in French. I totally understand people who are tired and they just want to give up and move on, and some people have done that. I guess what I would say to them is please look at what's happening in Ontario right now. Go and Google it, see what's happening in their hospitals, because it can happen here. Thankfully, we pegged our reopenings to increasing hospital capacity, so we're in a better position. But you know, if Ontario can run out of ICU capacity, we can do so here too. So we are so close to the finish line. So many sacrifices have been made for a year. We just need to get through the next few weeks. And if we do that, then the end is within sight, and we can begin getting to our summer and our freedoms and normal life more quickly, that we bend down this curve driven by these variants. So, folks, what can I say? I think one of the challenges here is that we have seen here and in other provinces that the variant growth being driven by younger people in the population. That is not, I don't say that to blame anyone, but I think maybe younger people who think they're just immune from the disease. I understand that view. But whatever age you are, you need to understand that without any bad intention, you can end up passing this on to other folks. So here's the deal. Please, if you can, stay at home, avoid social interaction, don't give that virus any chance to spread for the next few weeks. And if you do that, we can have the best summer we've ever had. We can gather with friends and patios and bars and homes and reconnect and make up for lost time. So it's a bit of a bittersweet message, but we are so close. Please, please avoid doing stuff that could end up jeopardizing our hospitals and forcing even tougher measures at the end of this thing. It's the last thing any of us want. So that would be my message. En français, pour dire que, s'il vous plaît, reconnaître que nous sommes à la fin de cette période d'adversité incroyable, mais il y a toujours une menace. Et si vous ne me croyez pas, regardez la situation dans les hôpitaux en Ontario, qui est une crise actuelle. On peut prévenir une telle crise ici en Alberta avec nos actions responsables pendant seulement quelques semaines pour défaire les variantes du virus et pour donner les vaccins l'occasion à gagner. Alors, s'il vous plaît, juste d'être soigneux, d'être responsable pour quelques semaines et le plus vite que nous débattre, le plus vite que nous défaire le virus, le plus vite que nous pouvons éliminer toutes les restrictions et nous sommes prêts pour un été incroyable de rétablir la vie normale si nous pouvons gagner dans les prochaines semaines.
And Audrey, do you have a follow-up?
Yes, I understand, Premier, that you're trying to find a balance between getting people to comply and giving them hope, but you keep saying that we'll have the best summer ever, we'll have a normal summer, we'll have Calgary Stampede, but isn't that maybe a little bit too optimistic? Isn't there a danger that it might backfire if we need to put stricter measures in place?
Look, I understand. Look, I really believe that people are sick and tired of fear, of being told what to do, and I think the best motivation is hope. I think the best motivation is getting back to something like normal this summer, a summer that we can enjoy. There will still be some measures that will have to be, but the promise of that, hopefully, is a motivator for the people who are least prone to follow the public health measures. There's a big chunk of the population that have been scrupulously COVID careful from day one, and I say thank you to those folks. There's a small fraction of the population who probably never paid much attention to this, and a lot of people in the middle who are just fatigued. And I think that the best way to kind of reach out to those folks is to say, we are so close. Vaccines every day get us closer to that level of protection that we need so that we can have something like a normal summer. And that's that hope, which I believe can inspire people to avoid social contact over the next few weeks. En français, pour dire que je crois que l'espoir est maintenant, avec toute la fatigue, la meilleure façon d'encourager les personnes de limiter leur contact social pendant les prochaines semaines. Parce que je crois qu'il y a beaucoup d'Albertains qui ont tanné avec toute la peur autour de COVID-19. Et je crois qu'un message d'espoir, de liberté, de quelque chose comme la vie normale en été sera plus effective en ce qui concerne le comportement de la population pendant la prochaine semaine. Thank you very much.
Thank you, and that concludes today's media event.